Hello guys, welcome back to Medical Coding Club. So today I'm going to explain you MDM table. Okay, so MDM nothing but a medical decision making. So recently I got many requests to asking me to explain MDM. So I thought of making a quick video on MDM, like how we are going to calculate MDM. So before that, if you don't have score sheet or if you are referring through book and you feel you felt it's difficult, then you can just download a e-brief series from APC, where you can easily understand that. When you go through the score sheet, easily you can understand because they have a very good explanation on each component of MDM. Okay, so let's just get started with the video. Yeah. So to calculate appropriate MDM level, we need three elements. The table A, which regards to problem addressed, table B belongs to data, and table C belongs to risk or morbidity. So all these three elements are important. So in this three elements, we have to take a point from all three table, right? So but the guideline says 2 out of 3 component or 2 out of 3 criteria. So in this 3 element, if we are meeting 2 elements which are higher level, so we can just go with that. For example, a problem addressed, you are meeting a moderate, and data you are meeting a minimal level, and coming to risk table you are meeting moderate. So you just have to take higher level, which is problem addressed moderate, and the risk is moderate, and you will go with the level 4 MDM. Okay, no need to think. In the MDM table, first we'll discuss problem addressed. So what are the levels comes under problem addressed and how we are going to distinguish between each level. So the first level is straightforward and the low, moderate, high. Okay, first we'll discuss straightforward. To have a straightforward, you need one self-limited or minor problem. Okay, the best example for this is maybe patient is coming for suture removal or maybe wound dressing. Okay, or also maybe a mosquito bite. Okay, these are all a self-limited and minor problem. So if you get only this kind of problem, you will take your problem address, that chart A level, as a straightforward level. So the next level is low level. So to code low level, you should have 2 plus self-limited or minor problem. So as I already explained what is minor problem, here you will have 2 or more minor problem, so your level will be low. And apart from that, you should have either maybe one chronic stable illness or maybe one acute stable illness. Okay, coming to what is one acute chronic illness means patient is having hypertension. Okay, patient is having hypertension from long back, but this is not the stage of hypertension, not either getting progressed or not either getting regressed. So this is a thing, that meaning is stable. And same thing applies to acute also. Maybe think like patient is taking a treatment from last week, but still the condition is not resolved. Okay, this is where you will consider as one stable acute illness. And then next point is one acute uncomplicated illness or injury. So patient is having an acute condition which is uncomplicated, and also patient is having a injury but it is also uncomplicated. Take an example of maybe cystitis or a simple sprain when it comes to injury, and maybe a simple laceration which says uncomplicated injury. So again, uncomplicated acute illness, you can take an example of upper respiratory infection or pharyngitis acute. You can just check in Google, you will get a whatever acute conditions are there, you will get that list. Okay, and one more point is one acute uncomplicated illness or injury requires inpatient or observation care. So in the documentation, probably you might have seen this, patient got shifted to ED or patient need observation care. So if this documented, so the next level is moderate. So to code moderate problem addressed level, we need 1 plus chronic illness with exacerbation, progression or side effect to the treatment, and 2 stable plus chronic illness with that 1 undiagnosed new problem and 1 acute illness with systemic symptom, and then 1 acute complicated injury. Okay, so these are the 5 elements which fall under moderate level. So the first thing is 1 plus chronic illness with exacerbation. That means patient is having a chronic illness from long back. Now the condition is getting progressed, getting exacerbated. So that is the meaning of chronic illness. And then 2 plus stable chronic illness. Patient is might having 2 or 3 chronic illness from long back, that is stable. So the next point is an undiagnosed new problem with uncertain prognosis. So the best example for this condition is premature ventricular contractions, which can lead to arrhythmias or cardiomyopathy. Okay, so it's an undiagnosed problem but which can lead to severe distress. And the next point is one acute illness with systemic disease. Okay, there is an acute illness and also with that there is a systemic symptom. So the meaning is a illness that cause a general or a single system symptom that has a high risk of morbidity without treatment. Okay, if the patient is not taking a proper treatment, that can cause a high risk of morbidity. So the example you can take severe respiratory distress, bronchitis with wheezing. Okay, all this can come under acute illness with systemic symptom. Next point is one acute complicated injury. So the AMA defines the meaning of complicated injury is it requires a treatment that includes evaluation of body systems that are not directly part of an injured organ. So whatever the injured organ may be, but patient need evaluation of other system also. Okay, that is a example of acute complicated injury. And to take a good example, concussion with loss of consciousness and fracture, maybe in the traumatic fracture and head injury. So all this fall under one acute complicated injury. So if all these 5 criteria if you are getting, you will just not all this, any one of the conditions you are getting, you will take your level as moderate. So next, coming to higher level, so here you need 1 plus chronic illness with severe exacerbation. So you should have the documentation where the condition is severely exacerbating. Okay, and then 1 acute or a chronic illness or injury which poses threat to life. So mainly here the condition should be life threatening. So then you can consider your level as higher level. Okay, these are all the points regards to problem addressed. So we discussed straightforward, low, moderate and high. So based on the thing you can just go to the appropriate level. Okay, so this is regards to problem addressed in the MDM table. So I have to discuss data and risk. So that I will discuss in future videos or the next videos. Thank you.